Good morning, dear viewers, once again. This is AremJoke Dental Clinics. As you already know, we are well known to disseminate oral health information, and we also treat patients. This is a dental clinic. So today we have a very nice topic, a topic of interest, mouth odor. Well, you all agree with me that mouth odor is a serious oral health condition that affects a lot of people. And as a result of that, many people they go silent. They don't want to talk in public places because of the mindset that, oh, my mouth is smelling, I cannot do this, I cannot do that. So this has always caused a lot of, how do I want to put it? It has always caused a lot of unnecessary silence, you know, in many gatherings. There are so many people feel introverted. They just don't want to talk just because they feel like, oh, if I say something now, you know, my mouth is smelling. So some people, it has affected their psychological mentality. So today we want to be talking about many aspects of mouth odor, also known as what? Halitosis. With me in the studio is a group of SIWES students from Ogun State Polytechnic of Health and Allied Sciences. They will be teaching us on mouth odor. So, can you introduce yourself, please?
My name is Olaniwe Blessing, a dental practitioner from Ogun State Polytechnic of Health and Allied Sciences.
Wow, so you are a dental student?
Yes, sir.
Okay, that's good. What about you?
My name is Alibon Waliat Oluwatimileyin. I'm from Ogun State Polytechnic of Health and Allied Science, and I'm a dental therapist.
Oh, wow, that's good. Well, you're welcome to the studio. You're welcome to AremJoke Dental Clinics. The problem here is, will you agree with me, Miss Olaniwe Blessing, that mouth odor is a major problem within the country and outside the country, you know, affecting most? Do you think most people, they don't really want to talk just because they feel like my mouth is smelling? Do you think that?
Yes, sir.
So you feel a lot of people, they just go silent, not just because they want to be silent, but just because they are afraid or they are shy of talking, right?
Yes, sir.
Okay, but can you please tell us what exactly is even mouth odor, this halitosis?
This halitosis is also known as bad breath. It's a bad odor that comes from the mouth whenever people are speaking, or maybe when you move closer to people. The odor that comes either bad or good, that's what we call halitosis, which is also known as bad odor.
Okay, wow, that's good. But this thing, I have a question. That the question is, why? What is the cause? Exactly, what is the exact cause?
Yes, this halitosis we are talking about. Let me say, there is causes for it. One, we have poor oral hygiene.
Oral hygiene.
Yes.
Okay.
Many people don't practice good oral hygiene, they practice poor. Let me say, for example, there are some people out there that I think, let me say, when you brush in the morning, that's all. No, that is all. When you brush in the morning, that's why, let me say, a toothpaste like this contains fluoride, and which lasts for 12 hours. So let me say you brush in the morning, after 12 hours, the fluoride, the effect is already gone. That's why we advise you to brush twice daily to bring the fluoride back, so that it's going to protect your teeth and your enamel, which is very good to the teeth and the dentin and the classes of the teeth. And likewise, under the poor hygiene, like I said earlier, some people brush once in a day, which is wrong. We have to brush twice in a day. And while brushing, there are some people that practice the wrong method of toothbrushing. Yes, I know there are some people out there who like, she has for you, she just brush her teeth, and which is bad.
Yes.
Yeah, let me say, I saw some set of people when they were brushing, they just like this.
That is how I sometimes brush. I usually brush like that too.
It is wrong, sir.
Okay.
It is wrong. Even let me say somebody that is late and going to work, not like, yeah, see the baby won't brush for the other time for you, just take it like this. Oh man, I'm sure before you no, that's bad. It is bad. You have to brush in the right way. So that's why we say in the morning, there are some people like this. Whenever they brush their teeth, they'll just take their toothbrush, they'll place it one place. You know, there are some people who don't like, Even the child said, oh yeah, it's going to come out, so we come, but no, it is wrong.
Where should we now put our toothbrush?
Your toothbrush, so let me, in the morning after you brush finish, you're going to raise it. There is some toothbrush that comes with cover. After you brush it, you raise it, you make sure that the bristle, which is the brush here, it is dry already. Then you cover and put it inside your drawer or somewhere beside your bed. Not somewhere where bacteria can feed on. Let me say in the toilet. Maybe the toilet after you defecate finish and you flush. After you flush, the aerosol.
If you evaporate, it will now settle down
on the brush. So, like someone like this, when this is already evaporate and it's still on the brush, you just take it. You will not even raise it. You just put your toothpaste.
So which means that somebody can even get disease from
that, and which is bad. So that's why we say you have to brush in the right way to keep a good oral hygiene to avoid halitosis. So you have to brush in the right way. I don't want people to be like, you have been saying this, so how do we brush? Yes, I'm going to show you how to brush in the right way.
I really like to know.
So you have to place this your toothbrush in the morning when you treat it from where you put it. Inside, maybe inside your bedroom, because I said this earlier. Stop putting it inside a place. You have to put your case. So you raise it. You raise it very well. It's not as if you just raise it, you just like no, it is wrong. You raise it because there are some bacteria. Let me just say, this cockroach, maybe their faces. It is just small like this, or even rats.
Like what geckos.
Yes. So it will just be inside the middle of this brush, and you just raise it like this.
So you have to inspect it.
Yes, you have to raise it very well. You raise it very well, you check the down, you check everything. Is this thing clean? Then after you raise it up, so you swap it like this to remove water. Then you apply a pear size of toothpaste. It's not the one that you put from here to here. No, that is excess fluoride. When you are using it every day, you are causing damage to your gut. Even you just like, no, it is excess fluoride. You put a amount like this. And the night you want to brush again, you put the same amount. No, it is wrong. Though it is wrong. That's why I said it's wrong. You have to put a clear size just from here to here. Yes, to just brush. After you raise it, like I said earlier, you are going to put clear size here. Then you put it at 45 degrees of your teeth. Then you brush. From the gum. Because the gum too, it is good. Because there are some this gum here, there are some people that has dark gum, and there are some that are just, let me just say reddish. It is not a disease. There are, let me just say, there are some melanins or hormones that are like that, maybe dark people. So that's why you have to take care of your gum. You brush from the 45 degrees like this. You breathe throughout to the side, to the left and right, and likewise inside too. You practice the same thing, so you brush. And under the poor oral hygiene, we still have, like I said earlier, you have to use a fluoride, a toothpaste that contains fluoride. There are some people that use, let me just say, ash toothpaste. You didn't know. Yes, I agree that you did not know about it. But that's why I said you have to use a fluoride. That's why you have to visit your dental clinic. Maybe you don't have the knowledge, or you'll be like, clean, close or take only fluoride, okay. That's it. You have to just go to your dental clinic. There are some dental clinics that sell toothpaste. So they will recommend the one that asks fluoride for you. Because let me just say, there are some people, I'm not abusing you, there are some people they don't know how to read. Or maybe let me just say all these mothers. Like you barely know how to English. So that's why you said you go to your dental clinic, they recommend a toothpaste for you, the one that is good. So you have to use a toothpaste that contains fluoride. Fluoride.
That means there's not all toothpaste that contains
fluoride. Yes, there are some.
So it's now very important that any toothpaste that we are going to use, it must contain fluoride.
Yes.
Because I can remember you said the other time that fluoride works for 12 hours.
Yes.
And as fluoride works for 12 hours, that means we have 24 hours. So that is the reason why we need to brush twice daily. Okay, so besides this wrong brushing techniques that you've been able to analyze, so what part of oral hygiene again would you want our people to consider?
I have to let you to consider your tongue. Okay. The tongue too, there are some odors, there are some people, whenever you brush, you won't brush your tongue. Let me just some people, you just use like this and just spit your tongue. You spit water out. You spit the water out. So that's why we have something that we call tongue scraper. This is it here.
Tongue scraper.
Yes, this is it here.
So tongue scraper. So this one you use it to scrape your
You
tongue.
use it to scrape your tongue. So you are going to scrape out the bacteria. You scrape out the bacteria. So after you
All the
brush
food
it,
particles.
yes, that will bring a good odor into your mouth. And there's something we call dental floss. I know there are some people, let me just say, in a standard restaurant, they normally use this. I know some people, you have seen it, maybe it's original voice. So this is what we call dental floss. You are going to use it instead of using your toothpick.
How do you use this one now?
Instead of using your toothpick, you have to use what we call dental floss. So I know there are some people, even in the restaurant, whenever you finish eating your meat, you are just going to pick this side, this place. You will use it to pick your tongue. No, there is different. Let me say this different place. It is used for different. It has a different method of making it. So this area, this group here, I just going to put it at the interproximal space of your teeth. The place where the food passes.
Okay, in between
Yes,
the lines.
in between.
Okay.
So to remove it, like you just remove it. It's not as if you are going to use this place or this place. No, it is wrong. This place, it is used for this surface that you use to wrap. So you know this soap, it cannot come into this place. This is it. So that's why you have to use this place to pick it out gently, so that you won't injure your tooth. That's why you have to pick it out gently. It's not the one you are going to pick it out aggressively. That this place it will injure your gum. You just pick it out.
Okay, so you mean that we are going to use this particular place, this sharp edge.
Yes.
It is okay to use it on the tooth surface.
Yes.
Okay, but not.
No, this one is
not.
no.
Okay.
Why this rope is used at the front of the teeth.
Okay. Well, thank you. But what kind of brush should we even use?
You have to use a recommend for you.
Okay, because I once heard that people who are using that wisdom toothbrush, they are smokers. That it is okay for smokers to use
and
wisdom.
it is okay for smokers, and it is not okay because there are some smokers that has tooth discoloration. That is why you have to use a small, a medium one that has a soft bristle. This is what I call bristle. Yes.
Is this soft bristle or medium?
Yeah, a medium brush with soft bristle.
Okay.
A soft bristle, and there are some products like they have a medium while their bristle is hard.
Okay, so you are telling us now that we should use a medium bristle brush. That means we also have soft brush. Do we have soft?
Yeah, we have soft brush that has flow. Yeah, that one they are for children.
Children.
They are for children. You cannot expect you should
Because
use it.
I also heard that they are for children and elderly people.
Yes.
Those who
Yes.
are.
They are for children. You cannot expect you.
Thank you very much for this brilliant discussion. So, coming to you, how will someone know that? How will I know if I have mouth odor? How will I even know? What are the signs? What are the symptoms?
If you have mouth odor, you will be perceiving some smell that are not pleasant. That even though people that are even close to you will be smelling that, they will tell you that this your mouth is
They will stylishly.
Yes, be covering your mouth. So sometimes you will not even be confident to speak outside. You will not be able to speak outside sometimes. And we also have your gum is going to swell. You have reddish gum. The way that maybe if you want to eat like now, you'll be having pains in your gum. You'll be having pains in your gum. So that's what most cause the signs that you will notice.
Okay, thank you. Coming to you again, I also heard from a reliable source that 3 things I heard that people who eat raw ginger, raw garlic, onions, that it also cause mouth odor. And also, I also heard that people who have these dirty things in their teeth, what do you even call it? dirty things that they used to wash. That
Stains.
Stain. No, is it stains? Plaque. Plaque. Is it plaque or calculus? Which one?
Plaque and calculus. It is true.
Okay, plaque and calculus. So I heard that they used to, and they also said that there is one thing. Is it hole in the tooth? What do people call that hole?
Yes, so that is what called dental caries.
Dental caries. So I heard that that thing is used to cause mouth odors. Is it true?
Yes.
How true is it?
Okay, let me start from the garlic. You know, when you eat garlic, ginger, it leaves a strong odor in your mouth. So I'm not advising, because there are some people out there who like tibaje, garlic, ginger, orisheto shifula. Yes, I admit. So that's why when you eat the garlic, you brush your teeth. You brush it very well by techniques I show you. You brush it so that it will not leave a strong smell in your mouth. And the plaque and calculus and the dental caries. That is why it is advised to visit your dental clinic twice in a year. That is once in 6 months, once in 6 months, which make it twice in a year. Even though you have any dental disease or any dental condition, you have to go so that the dentist there is going to check about your health, about everything, about everything to eat. And we have systemic disease. There are some systemic disease like diabetes. Let me say a diabetic patient. You went to an hospital and the doctor gave you medications. You didn't use it. You didn't use the medication. It is so the medication. Why you are not using it? Because when you are using the medication, it's not only for the diabetic, for the diabetes. No, it is because of your oral health. Because diabetes causes halitosis too. So that is why we are supposed to use any drug given to you at the hospital to avoid any oral diseases. And the dental caries, like I said, you have to visit your dental clinic for regular checkup. If you have any dental disease or any oral condition, just go to check. So if the dentist notice anything like maybe gingivitis, dental caries, peritonitis, periodontitis.
Hey, I don't believe me. All this very one now. Jesus Christ. Okay, so sorry to cut you short, but in long run, you validated my point that garlic, onions, and all those additives, food additives also cause mouth odor, and they also plaque, caries, like the hole in the tooth also cause mouth odor, right? And from my observation, from what I've been able to deduce from your points, you also affirm that mouth odor, people who are having systemic disease like diabetes, so they can also have mouth odor. What about people who are having ulcer? I also heard that people who are having ulcer too. Yes, that there is something they call it a H. pylori or something. Is it true?
Yes, it is true. That is why I said the medication given to you at the hospital, you have to because ulcer is like a hole in the stomach. So let me say
like a sore.
Yes, like a sore. So the smell, that is why like the medication given to you, it is used to heal the sore inside. So when you are not using it, so when the smell passes from your stomach to the door and you don't speak outside, the odor is just waiting.
People will perceive it. Okay, so from you, what else do you want to share with us? What information do you would like to share with us again?
I want to tell you about, I want to examine how medical conditions and medications contribute to halitosis. So one, there are some systems, I'll be talking about medical conditions associated with halitosis. One, we have kidney disease. Kidney disease, under kidney disease, we have pneumonia. Yes, pneumonia causes foul smell, which leads, causes foul smell due to bacterial and mucus accumulations, yes, in the kidney. Yes, and we also have liver disease, we have kidney disease also. All of those systematic diseases, as she said, yes, causes contribute to halitosis. And we have some medications too, like antidepressants medications, we have antidepressant medications, we have vitamin B, and we have some antibiotics when used long term.
For a very long period
yes,
of time.
for a very long period of time. It causes halitosis.
As well. Okay.
Yes.
All right, dear viewers, you've had a lot of information from the horse's mouth. These are sets of dental therapists in training at AremJoke Dental Clinics. They are students of Ogun State Polytechnic of Health. Thank you for joining us. We'll go on a short break right now, and by the time we are coming, we still have a lot of dental therapists in our studio today that will be enlightening us on the same topic, aletosis, but different subtopic. So thank you very much and stay tuned.